Good afternoon. I'm Max Donath, and I'd want to welcome you back to the next in a series of seminars, part of the Advanced Transportation Technology Seminar Series sponsored by the Roadway Safety Institute. Before I introduce our speaker, I'm just going to have Kylie Bivens give you some housekeeping. I just want to point out that the instructions she's going to give you are important. I watch these seminars live from Australia while some of them are going on, and I also watch some of them from Australia offline, and it works. So just want to let you know that you got to listen to her. Here she is.
Thank you, Max. As always, this is our 9th seminar, and we are streaming it live on YouTube. So we do have a remote audience as well as an in-person audience. And so for our remote viewers, please be sure to go into the chat box on your video and submit your name, affiliation, and number of viewers, because we have to report that information back to the US DOT. Same goes for everyone in person. Please be sure to sign in to the sign-in sheet that's sitting on the table right over there. For our online viewers, there is a 30-second lag. So if you have questions, please feel free to put them in the chat box, and they will be answered at the end of the seminar. Otherwise, I will hand it back over to Max Donath.
It's an honor for me to introduce Dr. David Ragland. He and I worked on projects together back in the mid-2000s, and I haven't really talked to him since then, believe it or not. Professor Ragland is the founding director of the Safe Transportation Research and Education Center and is an adjunct professor of epidemiology at the University of California, Berkeley School of Public Health. He's been the principal investigator on numerous projects funded at SafeTREC, more than $30 million since 2000. He's been actively involved in traffic safety efforts of the California Department of Transportation and serves as a top-level advisor on California state highway safety plans and the Federal Highway Administration's mandated 5% report for the Highway Safety Implementation Plan as mandated by the federal government. Highlights of his work include geocoding of collisions on California roadways, study of high collision concentration locations on California highways, studies of pedestrians and bicyclist safety, studies of roadway design, driver behavior, and I could go on and on. So without further ado, Professor David Ragland.
Okay. You have a mic. Oh, I have a mic. So can you hear me okay, all right? So, okay, welcome. This is the class, right? For credit? You all get A's. Don't do that, sorry. I'm not authorized to do that, so. I was just telling Max that my 8-year-old grandson put Pokemon on my cell phone. So last night I walked around and I'm going to bid out the hotspots on the campus. No, never mind. But there are some hotspots. I went to graduate school at SUNY at Buffalo. And when I thought, going to Minneapolis, well, it's about the same weather and so on. Except I looked it up. And Buffalo has an average 14 degrees in February. Minneapolis has an average of 6 degrees. So I thought, okay, never mind. I don't know. Okay, so as Max said, I'm director of something called SafeTREC, Safe Transportation Research and Education Center. We're a research group at UC Berkeley. Our mission is very simple: to utilize the capacity of the university, education, research, outreach, to reduce the burden of traffic crashes. We're affiliated with the School of Public Health, which is where my affiliation is, the Institute of Transportation Studies, which is parallel to what you guys have here, Transportation Engineer, same thing, just Department of City and Regional Planning. All parallels here, of course. And some of the things that we have done, just a little bit before I get into the main topic of this, we've been the sole provider for data analysis for the Strategic Highway Safety Plan in California since about 2005. It now, of course, has gone through one whole iteration. Now there's a second iteration starting that we've been involved in. This is the second iteration from 2015 to 2019. We've also done several safe routes. These are just some examples. Safe routes to school evaluations. We have several reports out there on our website and other places. We've developed something called Transportation Injury Mapping System. It has 2 million injury crashes from California over a 10-year period. It's publicly available. You can go to that website. There's various tools for mapping and some at least relatively low-level analyses involved in this. I'll talk a little bit more about that later, but it's used by many, many agencies in California, advocacy groups, and so on. We've done a study, a couple of studies of pedestrian safety around UC Berkeley, the campus periphery. Berkeley is kind of like a park, a little like a park, and you see in the center there, and maybe 20, 30,000 students and staff have to leave that park every day to walk to transit, walk to their dorms, and so on. And you see clusters of crashes there. This is not unlike many other university campuses, and we think this is an important area of study. We've done a similar thing around UCLA, and we're now proposing to do this around all the California campuses, the University of California and the California State campuses. But there's unique issues going from a park, like all of a sudden you're in an arterial, walking to transit. Okay, you might be surprised to see this in what we've done. Your Center for Excellence in Rural Safety, which I understand is not existing now, or is kind of morphed into something else, did a workshop in California in 2008, and I was asked to do some data presentation on rural road safety, which I did. And so I put that up to say, okay, I contributed to this. I did get some insights there that are going to be valuable to what I'm going to talk about. So our Tribal Road Safety Data Project, I'm not going to read all those goals, but basically we want to identify crashes in tribal areas and then to evaluate the reporting needs, the quality of the data, how these data are used for crash analyses, and finally present these data, provide these data to tribal groups and to others, and provide support and so on for tribes to continue to gather data and to be able to utilize it. California is a little different than other states. There's 110 federally recognized tribes. They're generally quite a bit smaller than the ones you'd find in Minnesota or the upper Midwest in general. See the road mileage, the population. About 20% of tribal members in California live within tribal areas. This happens to be more or less true nationally. So this is a consideration. We get asked the question quite a bit, are you looking at tribal areas or are you looking at tribal members? Well, we're looking primarily at tribal areas, but we're interested in the area around these where tribal members and other people live. So, we got started on this 2 years ago when the California State Department of Transportation was conducting a study of road safety in tribal areas. It was a workshop inviting people from all over the state. They asked us if we could produce some data for this. We looked around and there was just nothing anywhere. And we then decided, well, we have this geocoded crash data from our TIMS, our TIMS tool, Transportation Injury Management tool. And we got base maps, tribal base maps from BIA, and then we just overlaid them. So it's pretty straightforward. Oops, what am I doing wrong here? I'm somehow not able to, oh, never mind, sorry. I'll use this instead. So on step one, we have our base map with tribal data. Step two, we have base maps for 2 tribes in Northern California. It happens to be Hoopa and Yurok. We didn't label them here. And then we overlaid them. That's just about it. And then we can look within each tribal area to look at the crash patterns and so on. Turns out some of the tribes don't have land, 3 of them out of the 107. And we're able, periodically to get updates to the BIA files. By the way, we've also got now just recently the BIA shape files for all the tribes in the country from BIA, and with that we can overlay FARS data, which has lat long. That's pretty straightforward. It's going to take some time to do it, but we may be able to produce a sort of a nationwide look at tribal crashes on tribal data. There are some issues with the BIA shapefiles. They say don't use them for surveying or engineering, but they give us an idea of what's going on. So there's the data for each tribe. We're having trouble with the road network, and we've talked about this in some sessions this morning, some conversations. We have looked at the IRR, which is the Indian Road Reservation, and now it's called the TTP. It's a different name, and kind of they've changed the funding mechanism a bit. It turns out it's not, we'll go into that in a second. ESRI, which everybody knows, HPMS, which we've used fairly extensively, and then Caltrans is now developing a statewide road network. Caltrans only has 10% of the roadways, but they've been asked to develop a statewide network, which we're going to be involved in. Okay, there's all these road types in tribal areas in California. The reason they're significant is it determines things like jurisdiction with respect to all the way from road maintenance all the way to enforcement and to crash response. We're trying to come up with a roadway network where we can identify the road ownership because anyway, that's relevant in terms of recommendations and so on. To do that, okay, so we have the Indian IRR, now the TTP, and one issue with this is that it doesn't have location data lat long. Secondly, it varies by tribe. It depends on the expertise. It's all input submitted by individual tribes. I attended a workshop in this that was put on by BIA, and it's a complicated interface. And this is a situation where some people that I've talked to this morning could be able to develop this interface. So Nicole, there may be a contract for you in this, in helping develop the interface for the BIA for bringing in tribal roads. And we've looked at, here's ESRI and HPMS, and we've mapped them on the same map and stuff like that. They all have their limitations. HPMS is relatively limited in the scope. But here, these are just those two together along with crashes. Okay, some examples. Roadway departure. Roadway departure, I can't see it on the screen, so I'm going to have to wander over here, I guess, to see this, is one of the main crash types in tribal roads, as it is in rural roads in general. Now, all these are not rural. I want to make sure I hit the right button here, which is the one for the, is there a laser thing here? Well, anyway, you can see here the so-called Northern California Agency, they organized into agencies. 46% or so of the crashes are road departure. In Palm Springs Agency, it's about 12%. I don't know if you've been to Palm Springs, but at least half of it is tribal, Agua Caliente tribe. It's in kind of a square pattern, so you could be driving in and out of a tribal area several times as you drive across the town, and so on. Now, these are, well, anyway, you could see we're dividing these to two types, head-on and run off the road, and these are the total counts. So it turns out then that this is a major issue. This particular taxonomy is based on our current strategic highway safety plan. The top one, intersections, interchanges, and other roadway access, is actually several things put together, ramps and intersections and things, which I'm not sure if they should have done, but they did. That's why it comes out on top. The roadway departure is second. And you can see for tribal, it's 42% overall, and for California, it's 24%. So in other words, it's much higher in ranking in the tribal arena than it is in California as a whole, suggesting the importance of this. I'm going to run through a few slides here, but this happens to be the dividing line between Yurok and Hoopa. I'm sorry you can't see the reservation there very clearly, but you see, Hoopa Valley there and Yurok there. We need a better boundary there. These are road departure crashes in that area of Northern California. So we looked at clusters of these. I mean, we've looked at quite a bit of these. And we zoom in on a particular cluster and we can see the type of roadway. And so here we have a narrow roadway with no shoulders and no center line and so on. And this is an area that has some, one of these crashes or more. When we look at segments, we can get statistics like this, and most of these end up as hit object. That's the result of the crashes. They leave the roadway and they hit an object, partly related to the fact there's trees. This is highly, lots of trees in that area of Northern California. I'm going to go past some of these. These will be, but we've done things. This is La Jolla in Southern California. This is the type of roadway. More examples. It turns out that we get similar clusters within and outside of tribal areas. So if we have a state highway going through a tribal area, leaving it, going into another, find very similar types of crashes. In this case, we have a different kind of outcome. We have, in this case, most of the result of these are overturned. And partly it's because we have roads going along mountains and where there'll be a drop-off as opposed to trees. So you can get an idea that there's a different thing going on here. There's some that are hit object, but this is a different kind of pattern. But it's still leaving the roadway. That's the common theme here. There's some head-ons, not as many as one might think. The traffic is relatively low, so many of these are single vehicle. Well, almost all the roadway departure are single vehicle crashes. Caltrans contracted with SAIC, a big consulting firm, to do an evaluation of countermeasures that are needed in the state highway system. I'm not going to dwell on this at all. It'll be in the PowerPoint if you want to see it later. But there's about 113 in a set of tribes in California, and most of these are aimed at roadway departure. So we have center line rumble strips, edge line rumble shoulder, and so forth. And if implemented, these could have a major impact, we think. And we're now in the process of trying to determine how many have been implemented, right? There's a big step between recommendations and implementation, and we hope to have the results of that. These are just some maps of where the crashes occur. This is southern Hoopa boundary. Up there is within Hoopa reservation, and this is outside the reservation. You can see the very common patterns. And we have the injuries here that are marked, and then the countermeasures that SAIC developed. They provided, of course, the lat long for the countermeasures. So we have those. Okay. One more thing, not to dwell so much on it. Clearly, we have a very wide variation in different types of crashes have widely different geographic patterns. I mean, and so we've done, with our SHSP, we've done a lot of mapping of this sort by counties, by MPOs, and almost everything you can think of. This is by county. So road departure, Trinity County, which is very rural, has 10.9 per 100, per 100 million vehicle miles traveled, road departure, fatalities, and severe injuries, right? That's just fatalities and injuries, I think. San Francisco has 0.64. And for intersection and interchange, it just flips around. So we have very small number in Trinity and larger number in San Francisco. And by the way, any crash type that we look at, we have this drastic variation. And the SHSP attempts to make everything fit, the whole state, when in fact, there's a great benefit to looking at individual geographic areas. Now, it's kind of interesting. We've done several things like this. If you go in even further, you find the variation within county, right? In fact, if you go down, so you have, repetition of patterns like this. There's something they call that in systems theory. I don't know, hierarchical consistency or something like that, or patterning. But it's very striking. So pedestrian injury, for example, we may have clusters of pedestrian injury. The highest clustering of pedestrian injury is actually in the northwest counties of California, Humboldt and Del Norte. And it turns out the reason for that, the highest population base rate, that 101, Highway 101, which is like along the coast, is a freeway. It goes down to the city of Eureka, becomes city streets right there. And that's where all the pedestrian crashes take place. And they're enough to make it the highest or the second highest population-based rate for pedestrian injury. And you find very few pedestrian injuries. Anyway, geographic variation, that's the, that's the message. Dramatic. Summary, well, I've already said that. Okay, time and distance. So we got interested in this because in our interviews with tribal representatives, people would say, one of our issues is EMS. Sometimes there'll be a crash and that the ambulance never shows up. Or that they'll take a long time, if at all. Okay, we heard this a number of times. So we took all our crashes, since we geocoded, and we took the lat long of all the trauma centers in the state and just calculated the distance. Pretty straightforward. These are not actual times and distance. These are calculated based on the Google kind of stuff and that calculation. So we have Colorado River in the southwest portion of the state, 183, 3 hours to the nearest trauma center. Hoopa Valley, which we just looked at, 2 hours. In between, Agua Caliente is Palm Springs, 7.8. That's about standard for an urban area. There are some standards for response time, but clearly we have a wide variation there. And this is rural and urban, tribal versus state. Look at the yellow there. So even when you subcategorize by rural and urban, for rural tribes are still 23% higher. For urban, 37% higher. If you look overall, it's 107%. That's confounded with urban rural, right? Some of that 107% is because they're more rural. So that, but anyway, those are the minutes we calculate to the nearest trauma center. Now, as you probably know, the survival in a crash depends on several things. First of all, the quality of the crew that shows up. But it depends on the response time, how long you get to medical care, if it can't be done on the scene. And the second is the type of emergency room or trauma center you go to. You want to go to a level 1 trauma center. In case you're asked, I hope you never are. Never if there's an opportunity. But by and large, you want to go to a level 1 trauma center, and you want to go to the nearest one, regardless of the jurisdiction. There's these ridiculous jurisdictional boundaries of where you're taken and so forth that obviously are just, one has to think through these things. This happens to be Hoopa and Yurok. Somehow we have a lot of data on. And these are examples of where crashes are. Yurok, this is the Klamath River, and the state highway ends there, and then you can see it picks up again almost up near the ocean. And so if you have a crash here, I'll show you, you have a long way to go. So there's a town called Johnson's, very small settlement, up at the end of the highway in the Yurok. And that's the distance. This is a straight Google map, right? 2 hours and 18 minutes, 90 miles. If you saw these roadways, I'm sure you have things in Minnesota like these, but very windy if there's bad weather, rain and stuff like that. So major issue is EMS response time. We're now starting to work with the California EMS Authority, and there's a database called CHEMSIS, California EMS Information System. There's a national system developing now called NEMSIS, National EMS Information System, and I'm sure Minnesota has the same. The idea is to begin to create these databases that have things like response time and so on. In the slightly older days, back when we were working in the 2000s, they had trauma registries, but they were generally regional and the data were hard to come by. And now what's evolving is a national database with sub-databases. And we're hoping to utilize this to get actual response times, which we think will be more than the calculated ones. So, and here's the thing for transportation engineers, is to simulate an EMS system to consider all the factors of time, distance, these jurisdictional issues, and so on. And cell phone, by the way, communication, cell phone coverage is one of the big issues because cell phone coverage just disappears in many of these mountainous regions of California. So, okay. We'll go through that. So one of the issues under reporting, or we've tried several things that we're working on. One is crowdsourcing. We've conducted some pedestrian safety training at 2 tribes. And, well, hold on, then first responder and EMS data, tribal collected data. We've conducted with respect to, with respect to crowdsourcing, we've conducted some workshops in tribal areas on pedestrian safety. So we take all the pedestrian collisions we know about, put them on a big map in the workshop room, have people come up and indicate where they know a crash has occurred. And then we take a look at that. Now, an issue with that, of course, is memory and inaccuracy of where things happen, level of injury, and so forth. So one project, we're going to be applying for an NSF project. I think maybe you guys may have the opportunity to apply, but to be able to verify or validate crowdsourcing. Crowdsourcing now is sort of the big thing. But what we want to do is try to validate, is it any good? And if so, how good? Or how not good? Does it completely distort the picture? And if so, it would be sort of a boon, whether we get the crowdsourcing at a workshop or put it on the internet or and so on. First responder data, one of the tribes, Karuk, which is over to the west or the east of the 2 we were talking about, had limited data from the state database, SWITRS, which I described. And so they went to the fire department for that area and got run records. Turned out they're all hard copy, in a drawer somewhere. And they looked at these and they were able to build a collision data map, a set of collisions, do maps, and they obtained some fairly major funding from FHWA, I think, which is going on right now. So we want to look at first responder data, and we're probably going to focus more on EMS because the fire, at least there's becoming consolidated databases for EMS, whereas it's not true for fire department runs. As far as I know, there's no place where that goes where it would be accessible and usable. But it is a model for individual tribes. So now we're looking at tribally collected data, and turns out 33 of the 110 tribes in California have police departments. These are overlapping diagrams with how many have fire department and EMS. Eventually, we'll be looking at all of that, but we're doing interviews with police departments now. I've talked to several of you this morning that are far ahead of us in terms of the interviewing process, and we'll probably be consulting with you guys on this. It's quite difficult, requires a lot of patience. There are barriers to this that we have located that. Tribes are concerned that submitting collision report might sidestep tribal police department's legitimacy. There's issues of sovereignty. Why are we given data? As you know, the basis for the tribes in the first place was that they're sovereign nations. That idea legally still exists, although in modified form. And then there's resources, there's different types of police. Some of them are cross-deputized, and some are casino security, all the way from those. The factors that we can tell so far from our interviews, very qualitative so far, is who responds, or somebody responds, depends on crash severity, road ownership, hence we want to get ownership, and presence of whether or not there's a tribal police department. I'm going to skip this. This is a California-specific thing. There's a bunch of jurisdictions in California where the data goes into a so-called private property file and never to be seen again. All the University of California campuses are considered private property. State parks are considered private property. That means bike crashes, for example, go into this file. Some of the federal parks, like Yosemite and so on. We don't know the origin of this, but we are working with the Switters Group, Highway Patrol, to see if we can get access to this so-called private property file. Okay. Tribal data tool. Well, we're creating a tool that's patterned after our Switters tool. And the reason we're creating something different is tribes have expressed an interest in having something that they can use that's not public. And our job is not to judge this. Our job is to create a tool that can be utilized according to what the people who decide the policy, which is the tribal leaders, the state agencies, and so on, come up with. So we're creating it such that you can click on a tribe there. It's going to be password protected, and it's going to have the capacity to enter data. Again, our traffic interface, traffic data interface will be valuable here. And it can do various things, the usual things, select tribe, apply selection. By the way, buffers. We've done a lot of analyses where we look at a buffer. This is Morongo, which is near Palm Springs. So we have, this is just the tribal boundary. We have a few crashes. We find very often when we increase that boundary, this is 1 mile, that we have lots of crashes around the tribal area. In many cases, these will be tribal members that live just off the reservation. There may be others also, but this is an issue of some contention about, whether it's legitimate to look outside the tribal area. And the IRR has the philosophy, the stated policy. It's crashes within the tribal area, crashes on roads that lead to the tribal area or that the tribe uses for tribal activities. So it's a broader concept inherently. And that's where we're going to have the capacity to do different buffers here. Okay, different things that you can do with this that you might imagine. This is already up and running. It's not public. It's not going to be public, but we will be asking people to do a pilot study of it. And as I say, the ultimate, where this ultimately resides will depend on our discussions with tribal members and with state agencies. All sorts of stuff. Oops, too many things I put there. Okay, so training, technical support, and resource development. We have learned the one thing that we might be able to do something about is that resources and training is one of the barriers to tribal crash data collection. The Office of Traffic Safety, which is the the governor's highway governor's office, I think the equivalent in California, that distributes federal funds for enforcement and training and so forth, is interested in us enhancing the capacity of tribes to collect tribal data. So we're part of our survey now, and this upcoming round is going to be focused on crash data collection, whether they share it, what resources are needed for this. And so highly focused. It's things like tablets for entering data. It's things like interface software. It's things like software to store the data. And then it's training. So we're working with a group called the National Indian Justice Center, which is located in California, to help us with these interviews now. And then we hope to come up with some very specific recommendations for this, and perhaps assist in being able to obtain these data. So the final task 4 here is the Strategic Highway Safety Plan. And of course, every state is mandated to have such a thing, and we're maybe 3/4 or 7/8 or actually nearly into the end of our second round in the state. It's going to go on for 5 years. We've developed a tracking tool, and we're still involved in it. But we've floated the idea a couple of times of a tribal SHSP. And the reason is that we find many of the same issues in tribal areas as are found in rural areas, although there are some urban tribes also. But there are also some special issues, sovereignty, jurisdictional issues, resource issues that may be a little different, or maybe even very different than other jurisdictions. So, map 21, I guess I'm behind the time a little bit on that slide. But anyway, so these are our SHSP categories. One could come up with different categories when we saw those before. But we see, first of all, the yellow roadway departure, 41%, California 20, we already saw that. Interchange, but alcohol and drug involvement, 38 and 33. We had heard sort of anecdotally, you're going to find a lot of alcohol stuff. It's higher than the rest of California, but not that much dramatically higher. With respect, and so roadway departure head-on is if anything, is the category that stands out here. But other than that, we have a general pattern that's similar to the SHSP categories for the rest of the state. That process has been nearly complete, or is completed. The final report is out there, and we're going into the implementation phase of that. So this is just a graph of the same thing, a little hard to see, but so we have similar crash patterns, and so in other words, similar issues. And aside, then there's the jurisdictional issues. So the idea is to have a statewide SHSP for tribal areas. I floated this idea a couple of times to the people in Caltrans and so on, and got some positive feedback. Mostly, I think they're just exhausted, right? But I floated it to FHWA and got a little bit better response. So I'm still thinking of pursuing this. We need the buy-in of the tribal leaders, of course. But one could take all these various tribes, and the advantage of doing it is all this data has been collected, background stuff for the SHSP in general, Strategic Highway Safety Plan. And so that information exists, and one could sort of borrow it in a sense, and then bring in the issues that are unique for tribal areas. So I don't know what will happen to this. Maybe it's just an idea. But this would be one way to kind of tie together the tribes in a sense. Our tribal TIMS is another way to create a structure that the tribes in California, of course, are scattered all over the place. There could be 900 miles, from between them. And they come together in workshops and so forth, but this may be a way to see what the common issues are in tribal areas. So we're floating that idea, and we don't know what will happen to it. And I don't know what my time is, but I think I kind of raced through a lot of this, but the PowerPoint will be available, as I understand, on your website. It's been an extremely interesting process. There's several things planned. The FHWA is holding a series of road departure workshops. I mean, not just for tribal, but they've held 2 for tribal, for tribes in California, and we've done the data presentation for both those, and they're working on some other workshops that may be provided in California. So we've made ourselves available in California to present these data, and we've done that in several opportunities to do this. One of the most interesting was the Tribal Police Chiefs Conference workshop in a tribe called Shingle Springs. And you get kind of a different view when you talk, as we've learned this morning from our conversations, when you get down and talk to people about it, the difficulties that they may encounter, and maybe even more so, we're not saying anything new. The tribal police have, and the tribal members in general, have continuous interaction with the surrounding enforcement jurisdictions. And that many of them have MOUs, continuous discussions. Conflicts arise over jurisdiction in a particular crash. Highway Patrol says, can I come on, given Public Law 280, can I come on to your tribal area or not? And there have actually been instances where there's been delays in response, both to crashes, but also to other enforcement issues like domestic violence and so on. So we need to be very attuned to this and understand this as we go into it. So that's the end of my presentation. I raced through a whole bunch of slides there at once.
Thank you very much. We're going to open it up to Q&A, and let me start off with a question and a comment. You compared tribal crashes with California-wide crashes. Wouldn't it make more sense to compare rural parts of California to tribal lands?
Yeah.
It seems like the comparison to all of California is not quite right.
Yeah, as we get into further in the SHSP part, we'll do that, and we have done that with specific crashes, but not for this overall. But yeah, we should do an SHSP profile for rural versus urban in California. Absolutely, to do that. Yes.
Any?
Yeah, that's pretty much the question I had, but more specific to the comparison between California and tribal alcohol and drug impairment. Do you get any sense how different it is between in tribal regions and rural California?
Tribal region for alcohol?
Alcohol and drug impaired.
Yeah, we haven't done that yet. We've done quite a few different kinds of comparisons, but not that in particular. And so one might expect it we should stratify, just like we did with road departure, stratify by rural versus urban, for example, and tribe versus not tribe. Or in this case, we just put all of California. We could subtract out tribe, and then it would be tribe and not tribe. But in California as a whole, there's so many, it doesn't make much statistical difference, but to be more precise, we should do that.
Yeah.
I was also going to say something about the rural versus statewide, but I was actually going to hold back because my thought is that when you were looking at fatal, I guess serious injury and fatal, but most of our fatal crashes are happening in rural areas anyway. So I think you're a little bit skewed into the rural areas. But one thought I had was it's interesting about thinking about EMS response time. And I'm curious where you're getting your data. It had never occurred to me before here in Minnesota. to my knowledge, we have time to EMS first arriving and time to EMS, the first EMS reaching the hospital, but we only get that for FARS data. So we only know how long it takes when somebody dies, and we don't actually have a very good sense of how long it takes it for them to make it. So I mean,
Yeah.
you know, we really need to be looking at like, this is the bad time, and this is maybe why they're not surviving, and
Right.
what is our target? You know, our target should be the people that are surviving, and I don't think we have that in Minnesota.
Yeah. Yes, that's exactly the question for this. As I said previously, I mean, 15 years ago we started doing this stuff. There were trauma registries, and you had to go to them. There was the Contra Costa County Trauma, you know, and get their data. Okay, so there's one set of data. Well, what's happened over the last 15 years is that the national, you know, the federal government is setting up a federal system called NEMSIS, and National EMS Information System. Some people make a mistake and call it Nemesis. Anyway, but it's not. And then the individual states are setting those up, and in California it's called CHEMSIS. Same thing except California. And it has those data, but for all crash, well, let me back up a little bit. I have tried to use these data. I shouldn't say try. We have accessed some of these data. I did it for a EMS project we had several years ago. It's not terribly easy to use. The idea is that they put together EMS data with emergency department data, hospital data, if there is such. So you have kind of a whole history of what happened to somebody when they're injured at a certain level in a crash. First of all, it's difficult. We tried to track people through, and we had a lot of lost follow-up. I mean, some people are injured at the crash. There's an EMS crew. They decide not to take, they elect not to take an ambulance. They get to the ED, they're discharged immediately or something. So but yeah, we are now negotiating or talking to the California EMSA to see if we can use the California CHEMSA system to do exactly this, to get the response times for all levels of injury. And we'll just be focusing on the EMS to the emergency department or trauma center segment. So we hope we can get these. And then we hopefully will have real times instead of these calculated times. And as I say, if we can identify these data, we're looking for transportation engineer type to build a model of the EMS system with these data, putting in things like communication in a particular area, location, all this stuff, to determine, first of all, what are the current response times as a function of different conditions, and then how we can modulate the system to enhance those. And I think one of the things is going to be cell phone coverage will be one of those elements. How you distribute ambulances, how you dispatch them, where you locate them, you know, things like that. So we're looking for a student to do this. Anyway, thanks for that.
My other question is, what's the availability of air transport in these areas?
There is some availability for very severe crashes. It's very expensive, obviously, but yes, it is utilized. I don't know the exact rules for triaging to air support, but there's still the level, still the time it takes for an EMS crew to get there, which is considerable in some of these areas. Time to make the decision, time. But yes, that's one approach, very expensive approach to cutting down on the time. And it is utilized in California, probably here, Minnesota too, I think.
I was just going to add a comment about that. The airlift, actually, we've found in the data that Guillermo Narvaez and I are doing, collecting around tribal transportation safety in California, that because Indian Health Services has funds for airlifts, there's a preference for actually bringing people to, after crashes, to the IHS hospital, even though it's less prepared than some of the other hospitals in the region for responding to the trauma, because IHS will pay for the airlift to get to a true level 1 trauma center. So there are these really kind of paradoxical tensions over who's going to pay for that airlift and whose jurisdiction you're in, and whether you're really like trying to figure out whether you need emergency, whether you need immediate best available, or whether you need instead to sort of leapfrog to the trauma level 1. So it's just very complicated. I wanted to ask, around about slide 32 or 33, I think, you showed us a scan of what the tribes are doing in terms of interventions and kind of policy efforts to improve safety. And could you just take us back to that and kind of interpret a little bit and kind of the patterns that you see there?
Oh, one more comment on the EMS. There is another approach, and that's telemedicine. And there's a group in electrical engineering at Berkeley that are working on virtual medical providing. And we're actually looking for an EMS setting where we can pilot this. And basically it has some mechanism to send back a 3D picture of the victim in the vehicle, all the features. And the physician can look at that and can say, draw a circle, virtual circle, I'd like you to look at this area of the body. So the idea was you might have a virtual ER. I don't know how far this is in the future, but there is potential opportunity to do a pilot test of this. Now, they already do two-dimensional telemedicine in emergency response. But the idea of this is to create a fuller system. I'm not into the world of virtual reality. My sense is it's going very quickly. They're trying to create a situation where you can shake the hand of somebody virtually and it feels like a handshake, right? Create the tactile sensation. So apparently this is not Brave New World anymore. But now they want to apply this to emergency response. So that may be, but I'll go back to this. Anyway, we're kind of excited by that. It's way outside the realm of our expertise, but it could be, one approach. I'm not sure if.
I think it was around 30 or so.
Oh, way back there.
I think the technology would run into the limitations of communication.
Oh, the big issue is bandwidth, clearly. You can't do it over a cell phone. So they're apparently working on this. I'm not sure how they're going to solve this, but that's the core issue. Even if they get the setup from laboratory to laboratory, then there's going to be the deployment of it. So
I think the slide I was talking about is later.
later.
Is the countermeasures, Kathy, is it the countermeasures that SAIC did?
Yes, I think 33.
Oh, way back there. Oh, yeah. So these are countermeasures that SAIC developed under contract with Caltrans. And they're mainly focused on road departure. And there's 7,200 they've identified in the state highway system. 113 of those are in tribal areas. And so it happens. We've sort of done a little validation of this by plotting the crashes we know about along with these countermeasures. And it turns out there, at least by eyeballing it, a correspondence. Now, actually, we could do a total correspondence to this fairly easily because we have them for the whole state, and we also have the road departure collisions for the whole state. And one of our tasks now is to determine how many of these have been actually implemented. So
There's a correspondence of where you're observing crashes and where these countermeasures.
have been recommended. Yeah, the recommended area of the countermeasures. And that's, right, things like this. We've done several maps like this where we have, say, a cluster of crashes, and then we have, this is edgeline rumble strip, for example, edgeline rumble strip. And now this is just eyeballing. I wouldn't say this is a total validation of this, but we could do one could with these data do a validation of SAIC. We'll go back to Caltrans and say, either you got your money's worth or you didn't get your money's worth. So,
One question. I'm curious if whether or not you've done a crosstabs between jurisdiction with responsibility for the road and the location of the crashes on the tribal lands. And so you could see how many are on state highways, county highways, or tribal
yeah,
roadways.
we have.
And what does that tell you?
Most of the crashes take place, the highest number take place on the state highway system, secondly on the county roads, and then there's sort of another category. We don't have, that's using the HPMS, because we have those levels in the HPMS. We don't have a map that says, here's a tribal road, here's a VIA road. So we're hoping to build a network representation that has all those types of ownership, and then we could do a full thing. But right now, it's the state highway has the highest number, and it's for the state highways running through, by and large, running through tribal areas. But that's definitely one of our goals, and we're trying to develop a network that has ownership. And that's going to be key to who's responsible. Definitely.
You know, we're running out of time. I just want to, given all this discussions about countermeasures, I should point out that our very first seminar took a look at systemic approaches to preventing crashes by rank ordering areas, because we never, you know, crashes are a rare event at any given location. So anyway, I just want to remind everybody about our first seminar presented by Victor Lund, who's the county traffic engineer for St. Louis County, who actually presented methods for dealing with these kinds of issues. But anyway, please join me in thanking our speaker, David Ragland, for a very interesting seminar. I just want to remind everybody that there is no seminar next week. You are all invited to attend the Towards Zero Death Conference in Duluth instead. And our next seminar in the series will be 2 weeks from today, and the title is Complete Streets and Bicycle Pet Safety, presented by Professor Jason Cow in the Humphrey School of Public Affairs. So that's 2 weeks from today, same time, same place. Thank you.
But by the way, we have a contract with Caltrans to develop a systemic approach. And we may be applying it here also. So
Well, you should
that,
take a look.
that appears to be the wave of the future.
It certainly is. Thank you.
Thank you very much. It's been very educational for me.